Hi guys, this is Dr. Ratana with Capital Center for Surgery in Washington, D.C. Love That Body, D.C. I want to give you guys a picture of what the new world is going to look like. You know, we've been going through this pandemic and it's been tough on everybody. And now that we're going to reopen, I want to tell you some of the things that we're going to be doing to keep you safe, keep my staff safe, keep myself safe. One of the things we did is we ordered this antibody test. And today I'm going to talk to you about the FDA approval of this test. I'm going to talk to you guys about serologic tests and how they work in general. And then I'm going to tell you how this specific test is going to work and how we're going to use it here in the office. This company that makes this test was able to get an FDA approval under the emergency use authorization. What does that mean? That means that they submitted all the data that they have for this test, and the FDA took a look at that data and felt that it was a valuable test for the American people to have. And so now it's being sold and distributed throughout the United States to healthcare practitioners like me, so that we can do it on ourselves to make sure that we are not a harm to you, and we also are able to do it on you as well. So first, you get an incubation period. Let's say you're exposed to the coronavirus, and there's an incubation period of a couple of days where the virus is getting into your body. So the only test that can detect anything during that incubation period is that nasal swab. After that, your own body starts producing an antibody reaction to that antigen. And that's an IgM response. That's the first response your body is going to show when you first get infected. And that's also the time when you are going to show symptoms like a fever and that kind of thing. And there's also asymptomatic patients. But those asymptomatic patients still will show an IgM response. So this antibody test will show us if the patient has an IgM response, which is very valuable. We'll be able to tell the patient that they have the disease and that they need to seek care. Later on in the disease, then you get an IgM response that's going down, but also an IgG response that's going up, right? You're getting immune to that specific virus or antigen. And so the test also will be able to tell us that as well. And later on in the process, the patient will only show an IgG response. That means that they went through the whole disease process and now they're immune to that specific antigen. And this test will detect that you have that virus 87.9% of the time. So if you have been exposed to coronavirus, this test will detect that virus 87.9% of the time. So that means that 12.1% of the time it won't detect it. This, after all the data comes out, after the FDA really looks at the data, this test may show that it's not the best test out there, but right now it is the best test out there. And 87.9 is a really good percentage for sensitivity right now. Now, the good thing with this test though is that the specificity is 100%. That means if you don't have the disease, if you've never been exposed to coronavirus, this test would not tell you that you do have it. So that's a good thing. And that's on the IgM side of things. On the IgG side of things, the specificity is actually very high. It's 97.2% of the time. So if you are immune to this virus, you've been exposed already and you had an asymptomatic infection, and this test detects that you have an IgG in your blood, 97.2% of the time is going to be accurate. This is a test, this is a true test from someone who took this test. This is a patient that proved to be, we ran the test and they have an IgM response. What does that mean? They're actively infected, they're asymptomatic, they could have a fever, they could have some symptoms, but they're showing an IgM response, which is early on in the disease process, and it looks like the test did work because we have the control band as well. So this patient, if they come to our office to get surgery, we would tell them that we're not going to perform surgery on them today, and we're going to send them to their either primary care doctor or the hospital to get further care. This is another test that we ran on another patient. This one is a patient that has an IgM band, but also an IgG band is there as well. Again, it takes about 10 minutes for this whole reaction to take place. So you have to be patient. And then the control band also lit up. So it means the test was good and it shows 2 bands. So that patient is in this phase of their disease. They already went through the symptomatic phase, but now they actively have the disease. And also a patient with this kind of test in our practice, we will not be doing surgery for them that day. We're gonna wait until they're at this stage where they're past the IgM response, and now all they have is an IgG response, just the one band right here. You know, the new world is going to be a little bit different, with a lot of people wearing masks, people taking your temperatures, people doing tests, but all of that is to keep everybody safe. You, your loved ones, myself, my staff, and everybody else. This is something that we feel very strongly about, testing our patients, especially before surgery. And if you come to see us at Capital Center, you're going to be getting these tests. And I just wanted to make sure that people understood how this works. I hope that you guys learned something about immunology today. And if you didn't, please drop a comment on the bottom. Ask me whatever questions you have about this test or about anything really. And I just hope that you guys have a great day.